Hello friends, today's topic is, can asthma be diagnosed in kids below the age of 3 and 4 years old? And this is a question that I receive very commonly, whether I speak with parents groups or when I speak with pediatricians whom I lecture not just in this country but also around the world. And this is a very what I would call challenging question, both for the families of kids who are being given the diagnosis as well as for the pediatricians or the family doctors or others who are considering the diagnosis, because historically we have all been told that you can't diagnose asthma in a child below 3 or 4. So friends, this is Dr. Sitesh Roy, your allergist, immunologist and asthma specialist, coming to you with this special video. Stay tuned for all the details. So when we think about asthma, as a definition, it means a child or an adult who has what is called reversible airflow obstruction, which means their air tubes get narrowed due to a variety of different triggers that can range from viruses or infections to allergens and to other irritant and pollutant exposures. And this can be reversed by giving something called a bronchodilator, which is commonly used in India, called salbutamol or levosalbutamol. Now, knowing this definition, it becomes a challenge if you have a child who's got cough, maybe with or without wheezing, shortness of breath, they are having trouble breathing, whether this is just an infection, what would be classically called a wheeze associated with lower respiratory tract infection, or a virus-induced wheeze, or is this really asthma which has a different set of triggers and different line of management than just a viral-induced wheezing. And hence what we're going to look into today is what are the factors that help us narrow down a diagnosis of asthma in a child who's 1, 2, 3, 4 years old. Recognize that there are international guidelines now, like what is called the National Heart Lung Blood Institute NHLBI guidelines. There are the GINA guidelines, and in several of these guidelines there are age groups in which the asthma has been broken down into. So there's a 0 to 4 age group, which means the diagnosis can be made there. There is a 5 to 12 age group, and then there is a 12 and up into adult age group. Recognizing this, it should become clear to most practitioners and to the lay population public that a diagnosis is possible. What are the factors that go into such a diagnosis? So the first one of the factors would be a child who has had more than 3 or 4 episodes of wheezing, cough, breathlessness, which is responding to bronchodilators, which I have mentioned before, and a need potentially at times of even having to take steroids, whether it is inhaled steroids or oral steroids for recovery, and recognizing that some of these episodes will be triggered by viruses. Fever, cold, cough is also going to be there. But when these episodes are bad enough to require oral corticosteroids, we start worrying about the potential for asthma. Now, when there are more than 3 or 4 episodes and we recognize that the child also has what may be considered allergic symptoms. So allergic symptoms can mean having atopic dermatitis, which is also called eczema, which comes up on the face or on the creases, can come up on the torso, dry, itchy, red skin. There can also be food allergies that the child has to milk, egg, wheat, peanuts, other foods. When there is also a raised white blood cell count of a type of cell called eosinophils, or when the parents or immediate family members or siblings have asthma or allergies commonly known in their medical history, all of these factors should raise the level of concern in the treating physicians or the family's mind that maybe these 3, 4, 5 episodes that are occurring are not just a virus-induced wheeze or cough, but they actually are asthma. And how can we go ahead and try to narrow this down? There are now investigations available, as I said, a simple complete blood count. Sometimes you can also go in for allergy skin testing, or there are blood allergy tests, but you have to be careful which one you choose. There are many spurious or inaccurate blood tests out there, so please do that with guidance. And also there is something called forced oscillometry testing, by which even down to a 2.5, 3-year-old child, through a passive technique where they are not required to blow into a machine, like would be called a pulmonary function test or a lung function test, we are able to get an idea whether the child's air tubes are narrowed or swollen and whether they can be opened up by giving a bronchodilator. So in 2025, friends, it would be wrong for anyone to say that asthma cannot be diagnosed in a child below 3 or 4 years of age. It absolutely can be diagnosed. Sometimes it's a purely clinical diagnosis, which means a subjective diagnosis. Sometimes it can be a clinical plus objective diagnosis with tests and investigations to help us support the identification of this condition. You would ask me, why is it important, Dr. Roy, to really make this diagnosis? Because when you diagnose asthma, you are now raising the level or the bar of your level of monitoring, your level of therapy, your level of follow-up that you do for this child. Because while everyone may say once you get the label of asthma, you'll never ever outgrow it, I don't think that that's true. Asthma with the right kind of treatments, the right kind of interventions can be superbly controlled and can definitely go into remission also. Whereas if you just take this as an episodic wheeze or a viral wheeze or a wheeze associated with lower respiratory tract infection or a reactive airway disease, then you're going to treat the child only when they have symptoms and you're not going to give them any preventive care in between the episodes. And that, my friends, is where the right diagnosis and the right treatment makes all the difference in the world. And I would encourage those who are practitioners who are listening to this, and also for parents, to further educate themselves, discuss this with your peers, with your doctors, and take the right steps to make the right diagnosis, because it can mean everything in the world for preserving the child's lung function, which is the lung growth of the child, to making sure that they have a healthy, happy life where they can study, play, exercise, be normal kids, and also in the long run give them the best chance to beat this disease and come out of it. So friends, hope this answers a lot of your questions. Till the next time, this is Dr. Roy signing off. Take care, stay safe, God bless us all.